Bachman. On behalf of CME Outfitters, I'd like to welcome you and thank you for participating in the CMEO briefcase educational activity entitled Pivoting to Telehealth, Optimizing Technology for the Care of Postmenopausal Women. As I mentioned, I'm Gloria Bachman, Professor of Obstetrics and Gynecology and Medicine, the Associate Dean for Women's Health, the Director of the Women's Health Institute, and the Medical Director for the Proud Gender Center of New Jersey at Rutgers Robert Wood Johnson Medical School, New Brunswick, New Jersey. I'd like to acknowledge my colleague, Dr. Juana Hutchinson-Colas, who collaborated with me to develop the patient case we'll review. Let's review the goals for the program. Our first learning objective is to apply current evidence-based guidance on benefits and risks of hormone therapy to counseling and treatment decisions for postmenopausal patients. Our second learning objective is to implement best practices for telehealth consultations with postmenopausal patients. Let's begin by meeting our first patient, Clarice Collins, a 52-year-old postmenopausal woman. She's up to date on her mammogram and her PAP, and she's requested a telehealth visit to discuss new symptoms, including sleep disturbance, nocturia, vaginal discomfort and burning, and sexual pain. As clinicians, we're accustomed to seeing patients like this in our offices, but today, I want to focus on how we can best manage patients like this by a telehealth visit. We need to be aware of how our words and subtle actions can make or break the therapeutic relationship with our patients during a telehealth visit. As we watch the first video demonstrating a virtual clinical visit, see if you can spot things the doctor says or does that could be getting in the way of providing optimal care for the patient. Hi, Ms. Collins.
Hi, Dr. Bachman.
So I'm reviewing your chart, and it looks like everything was normal at your last annual visit. What prompted you to schedule a telehealth visit today?
Well, I'm really bothered by not being able to sleep. I'm hot all the time. I'm waking up to go to the bathroom throughout the night, and I have trouble getting back to sleep because I feel hot. I'm also having some burning in the vagina, mostly during having sex.
Are you drinking any fluids in the evening?
I have a cup of herbal tea every evening because it helps me relax, and I hope it will help me sleep better.
Well, you ought to know that drinking tea right before bed is not a good idea if you're complaining of urinary frequency. So that's one strike against you if you want to sleep through the night. Now, the other issue, what about the temperature in your house? Have you tried lowering the thermostat?
Well, we keep it pretty cool at home, but that doesn't seem to help me from feeling hot sometimes.
Well, try cooling it down a bit more. Or does your husband not like for the house to be too cold? If he doesn't like him, tell him to put on a sweater.
I don't have a husband.
Oh, well, your boyfriend or whoever lives with you. The point is, keep it cool. Between that and cutting out the bedtime tea, you should be able to sleep better. Now, what other concerns do you have?
Well,
Wait, hold on just a second. My phone is ringing. Okay, I can hold off on that. Okay, go on.
I was saying I've been having a burning sensation in my vagina, especially during and after sex, and I'm having pain during sex, which never used to happen.
Are you having any relationship problems that might be related to your sexual problems?
No, my relationship is fine. I want to have sex with my partner, but even when I feel aroused, I just don't get as moist as I used to.
Well, you know, you're getting older, so you're not going to have the same sexual function you did when you were in your 20s. Vaginal dryness and burning is common in women your age, but that's what over-the-counter lubricants and moisturizers are for. Have you tried any of those?
Yes, we bought one lubricant and tried it a few times. It didn't seem to make much difference and it's really messy.
Well, of course, it's going to be messy. That's the whole point of a lubricant. And you can't just try one product a couple of times and conclude that they're all useless. There may be one that works best for you and that you just haven't tried it yet. So look, why don't we do this? Stop the tea and really try to keep the room cool. I know sometimes guys don't like it to be too cold, but just tell him he has to deal with it. And try all the different kinds of moisturizers and lubricants. Let's see how you do with those changes. And then, if you're still bothered, you can schedule another telehealth visit in 6 weeks.
Well, that felt like a waste of time. The doctor seemed like she was in a hurry and made me feel stupid for drinking tea before bed. She didn't seem to take my symptoms seriously or offer me any ideas, new solutions other than things I've already tried. She just assumed that my sex partner is a male, so I didn't feel comfortable telling her that I'm married to a woman. I left the visit feeling even more discouraged than before.
Let's talk about what we just saw. This telehealth visit was done the wrong way. The clinician had poor bedside manner or webside manner, appeared distracted, lacked empathy, assumed the patient was heterosexual, that offered behavioral interventions in a shaming manner. There was no additional treatment options other than the behavioral ones, and didn't offer any type of follow-up in between telehealth visits, not even a phone call to the office. So there really are some tips that all of us can use when we are conducting a virtual visit with our patient. And really, I think the most important is engaging with the patient, that the patient is, quote, in our office, despite the fact that they're not physically with us. And we should make sure that we're looking at the patient, break the ice, be empathetic, be an active listener, avoid unnecessary movements and multitasking, and close the visit in a way that the patient knows your office, you are open to further follow up. And if there are any issues or concerns before the next telehealth visit or inpatient visit, that you are available. Many women don't realize the symptoms of menopause that erode their quality of life are treatable. So that's why it's so important during the telehealth visit that you let the patient know that there are interventions that will assist in getting rid of the problems, either the vaginal problems, the hot flushes, the sleep disturbances that she's experiencing. Let's return to that initial consult with our patient, Ms. Collins. In this next video, see if you can spot ways that the doctor implements some best practices for telehealth. Hi, Ms. Collins. It's nice to see you virtually.
Hi, Dr. Bachman. Nice to see you too.
Now, can you see and hear me okay?
Yes, thanks.
Okay, now tell me what prompted you to schedule a telehealth visit today.
Well, I'm really bothered by not being able to sleep. I'm
Mhm.
hot all the time. I'm waking up to go to the bathroom 4 to 5 times a night, and I often wake up drenched in sweat and having trouble getting back to sleep. I'm just starting to feel like a zombie and never getting a good night's rest. I'm also having some vaginal discomfort due to dryness, and sometimes I have burning sensation in my vagina, mostly during or after sex.
Wow. All the problems that you've described, all the symptoms can really be distressing. What you're describing are hot flushes and night sweats. The first thing, though, that I want to assure you is that these symptoms that you're describing are very common among women going through the change of menopause. I'm looking at your chart and I see that your last period was about a year and a half ago. Is that correct?
Yes, that's right.
And how long have you been having these symptoms that are so bothersome to you?
I think they started about a year ago, but they're really been bothering me more in the last 6 months. The hot flushes make me feel like I'm going to burst into flames.
Well, fortunately, we have a lot of options to help you find some relief. The first is to think about changes you can make to your environment or daily habits and over the counter products that might help with the vaginal dryness. If these aren't sufficient, then we can discuss prescription medication options. First, tell me what you've already tried.
Well, when I'm feeling hot, I drink ice water or take a cool shower. I've not wanted to take sleeping pills, so I just drank a cup of herbal tea every evening that's supposed to help with relaxation and sleep. I don't know if it actually helps with sleep, but it's a nice part of my evening ritual to wind down for bed.
I agree with you. I also find a cup of hot herbal tea to be very relaxing, but it may not be helping if you drink it at night right before bed. You might want to try having it right after dinner and then try not to drink anything for the hour or so before bed. And try to empty your bladder right before you go to bed. Does that sound like something you could do?
Oh, yeah, that makes sense. I'll shift my tea time earlier in the evening.
Okay. And for the hot flushes, it sounds like you're doing good things to cool yourself down when they come on. Have you tried turning down the thermostat in your bedroom?
Well, we usually keep it around 72, which feels comfortable when I'm not having a hot flush. But I can lower it if you think it'll help.
It can help to lower the air temperature and also to dress in layers that you can shed when needed. Other things you can try as well, which you may have already, is limiting your alcohol, your hot beverages, and spicy foods.
Okay, I'll try that.
Now, for the vaginal dryness you described, have you tried any of the over-the-counter moisturizers or lubricants?
Yes, I bought a lubricant and tried using it a few times, and it didn't seem to make much difference with the burning and the pain I feel during sex.
Hmm. Now, I'm sorry to hear that the lubricant isn't working for you. You mentioned that you're experiencing pain during sex. Are you having any vaginal bleeding or other concerns related to your sexual health?
Just the burning sensation and the pain during sex. I haven't had any bleeding, and I'm not worried about STDs or anything else. I've had just one partner for over 10 years now. I'm just not getting moist, even when I feel aroused. It's frustrating that my body doesn't respond the way it used to. I hope this isn't the end of our sexual life.
Oh no, menopause definitely does not have to be the end of your sex life. I certainly want to try to help you find relief. And the good news is that there are several different kinds of moisturizers and lubricants available that may help with the dryness, the pain, and the burning you're describing. Unfortunately, there's no single best product that I can guarantee will work for you, but for many women, they do find experimenting with two or three different products is worthwhile because one of them may work better than the other. Is that something you're up to for trying?
Sure, but what's the difference between a moisturizer and a lubricant?
That's a good question. Lubricants are intended to be applied just before sexual exchange, and they're intended to provide short term relief from pain during sex due to dryness, whereas moisturizers are applied on a regular basis, several times a week or even daily, and are intended to rehydrate the dry vaginal tissue in order to reduce the discomfort from vaginal dryness on a daily basis.
That makes sense. It's good to know that just because the first one didn't work for me doesn't mean none of them will.
Exactly. And don't worry, if you don't find relief with over the counter products, we have other options. We may want to consider starting hormonal therapy because that is a proven effective way to deal with the symptoms that you're having, from the hot flushes to the sleep disturbances, even to the vaginal dryness. It looks like you're up to date on the mammogram and the pap as I'm reviewing your chart. And since you aren't having any bleeding or any other specific medical conditions, there's nothing standing in the way of us initiating hormonal therapy for you during a telemedicine consult. But let's try some of the other things first. How about you try, lowering the temperature, trying to limit the beverages right before bedtime, trying some new over-the-counter moisturizers and lubricants. And then let's talk again in about 4 to 6 weeks to see how these changes are working for you. If you're still not getting the relief you want, then we'll talk about starting hormonal therapy. How does that sound to you, Ms. Collins?
That all sounds great. I'm going to do my best to follow your recommendations, and I really hope this works. Thank you.
Do you have any questions or concerns that I can help you with today other than what we've talked about?
I don't think so. I think we covered everything.
Okay. Now you can also learn more about menopause symptoms and things you can do to manage them on various websites such as menopause.org. And if you think of any other questions that I can answer for you, please feel free to call the office at any time.
Okay, will do.
Now you take care and I'll talk to you soon.
I'm so glad I made that appointment. It's a relief to know that what I'm experiencing is common, and I learned a lot of things I can do to manage my symptoms better before trying medication. I really appreciated that my doctor took the time to listen to me and reassure me that there's hope. I felt like she really cares about helping me and she has a clear plan. I hope the changes she suggested today will help, and it's good to know that there are medications I can try as a next step if I need them. I really like my doctor could see me through telehealth so that I didn't have to go into her office. It saved me time. It was less stressful than driving in traffic and sitting in the waiting room with other people.
We just heard from Ms. Collins that telehealth can be an effective platform for managing symptoms of menopause. And they can be comparable to those with traditional healthcare delivery systems and methods, as we just saw. That it does improve patient engagement and satisfaction. Ms. Collins was very happy with the encounter. You can do full consultation on how to manage menopausal symptoms, and it allows clinicians with traditional office-based practices to maintain continuity of care for their patients. Many of the other benefits of telehealth visits are that it eliminates the travel time, the costs, the long waits in waiting rooms. It reduces time that women have to take from work or caregiving responsibilities, and it's a cost savings for both patients and the healthcare systems. Clearly, telehealth is a cost-effective way of caring for patients. Data have shown that telehealth visits save $19 to $121 per visit by diverting patients from more expensive care settings, and almost 3/4 of patients have their health concerns addressed during a telemedicine visit. And actually, 16% of patients would have done nothing if they had not done a telehealth visit. Even though telehealth is an exceptionally great way of seeing our patients, especially during pandemics, there are some barriers to telehealth, especially for postmenopausal women. And these include the lack of internet and phone access that some patients may have, the lack of technological knowledge or training in how to access a telehealth platform. There may be doubts about cybersecurity, and obviously, in homes where there is no privacy, the woman may not want to discuss her symptoms with other family members or friends around. It's clear that there are many sources of data, including the Cleveland Clinic and the Department of Veterans Affairs, that show that telehealth is a successful platform for caring for patients, and that patients embrace this form of clinician-patient relationship, especially when an in-office or physical visit or lab testing is not necessary. So let's think back to the video we saw demonstrating an effective way to conduct a telehealth visit. What did the clinician do? Well, there was good bedside manner, there was empathetic communication, education on both pharmacologic and non-pharmacologic interventions, and a follow-up plan in 6 weeks, so that if there are other aspects of the hormonal therapy that had to be adjusted or addressed, the patient would be doing it at that point. So let's talk briefly about the vasomotor symptoms of menopause, which basically is a common presenting symptom that women come to a clinician for help or assistance with. From the data, we know that menopausal symptoms can last for up to 7.4 years, and they are associated with many of the symptoms that we saw Ms. Collins complain of: sleep quality, sexual symptoms, as well as difficulty concentrating, reduced quality of life. And menopause is also associated with health problems, cardiovascular, bone, and cognitive risks. So that hormone therapy remains the gold standard first line therapy for relief of vasomotor symptoms in appropriate candidates. Genitourinary syndrome is another common complaint that menopausal women want assistance with. This type of atrophy that occurs in the vagina actually worsens over time, so that as women enter into their postmenopausal years in their sixth, seventh, eighth, ninth decades, that they may actually note that the condition gets more severe for them, so that they're more symptomatic. And again, estrogen is the most effective treatment for genitourinary syndrome of menopause because it does improve the genitourinary tract anatomy. It increases superficial epithelial vaginal cells. It decreases vaginal pH. And most importantly for the woman, it improves her symptoms. Low-dose vaginal estrogen preparations are effective and generally safe with minimal systemic absorption. So what are some of the approaches that we can use in assessing genitourinary syndrome of menopause? I believe the first is starting the conversation. That many women are reluctant to bring up this topic, so we as clinicians can start with something as simple as many women after menopause have concerns about sexual function. What about you? Tell me about it. And also asking direct screening questions. Do you have problems and concerns related to sex or pain with sexual activities, bleeding after sex, or problems with urinary leakage during sex? And the other key point is don't assume the patient is heterosexual or partnered. Now let's return to our patient case, Ms. Collins. In this first video of a follow-up visit, see if you can spot things the doctor says or does that could be getting in the way of providing optimal care for this patient. So you're back, Ms. Collins. Are you feeling any better?
Not much. I've been doing all the things you told me to do. We turned down the thermostat, but I don't think the hot flushes are any less frequent. I still feel like they're out of control day and night. I stopped drinking tea in the evening, and now I only need to go to the bathroom 2 to 3 times a night. But I'm still having night sweats, and I still never feel well rested. And for the vaginal dryness, I've tried 2 moisturizers and 2 additional lubricants, and I think some of them help a little, but they're really messy, and I still have some burning and pain during sex. But honestly, that's not as hard for me to deal with as the sleep disruptions. I'm just really feeling exhausted and mentally drained from never being able to sleep through the night.
Well, it is good that you quit the bedtime tea. It sounds like to me that that gave you a big improvement from needing to urinate 5 times a night to only 2 to 3 times a night. Can't expect to sleep through the night at this age the way you did when you were younger. And like I told you the last time, vaginal dryness is to be expected at your age, but that's what the lubricants are for.
Okay, but my biggest struggle is with the hot flushes. Are there any other options to prevent those or give me more relief when they come on?
Well, it sounds like they're really bothering you. It sounds like you need hormonal therapy. I'm going to write a prescription today to get you started on that.
I thought I heard that hormone therapy would cause strokes. Are you sure it's safe option for me?
I wouldn't prescribe it for you if I didn't think it was safe. Look, if you don't want to take it, that's your decision. but then there's nothing else I can help you with. Now, let's look at a better way to conduct that follow-up visit. Hi, Ms. Collins. It's so nice to see you again.
Nice to see you as well, Dr. Bachman.
Now, I'm reviewing your chart, and I know the last time we spoke, you were having pretty significant hot flushes, night sweats, and vaginal dryness. And we discussed some measures you could try to see if we could improve them. Have you felt any positive effects from the interventions you've tried since we spoke last?
Well, I've been doing all the things we discussed. We turned down the thermostat, so now my partner is always wearing sweaters. And I'm often cold as well until a hot flush comes on. And when it happens, I'm glad that the house is cooler. But I don't think the hot flushes are any less frequent. I still feel like they're out of control day and night. I stopped drinking the evening tea, and now I only need to go to the bathroom 2 to 3 times a night. But I'm still having night sweats, and I still never feel well rested. And for the vaginal dryness, I've tried 2 moisturizers and 2 additional lubricants. And I think some of them help a little, but they're all so messy. And I still have some burning and pain during sex. But honestly, that's not as hard for me to deal with as the sleep disruptions. I'm just really feeling exhausted and mentally drained and never being able to sleep through the night.
Yeah, it sounds like you've really tried everything we've talked about the last time, and you're still having very distressing symptoms that bother you a lot. I think it's time to consider starting hormonal therapy. This should take care of the night sweats and the hot flushes, which should really improve your sleep. It sounds like you've done everything you can to try to eliminate them or make them manageable, but they're still really disruptive.
Yes, they are. And I'm desperate to try something new that might help. But I thought I heard that hormone therapy could cause blood clots or strokes. Are you sure it's safe for me?
Yes, it is true that hormone therapy increases the risk of blood clots and strokes in older women, but many studies over decades have shown that these events are very rare in women in their 50s or within the first 10 years of menopause onset. You're within that age range, and you don't have any medical history as I review your chart again that puts you at increased risk. Hormone therapy is the most effective treatment for the symptoms you're having, and it is recommended by all the professional organizations that issue clinical practice guidelines for menopause management. So I recommend that you try it, but it is your decision. So please ask me any questions you may have.
Thank you. That makes me feel better. I'll try it if you think it's safe and likely to help.
I do. So we'll get you started on hormonal therapy. You have your uterus, so I'll prescribe a progestin and the estrogen. You have the option to take a pill every day or use a transdermal patch on your skin that you replace once a week. Which would you prefer?
I think taking a pill each day will be easier.
Okay, so then what I'll do is I'll send the prescription to your pharmacy, and then I'd like to see you in another telehealth visit in 3 months to see if the medicine is working.
Sounds good. Thank you.
You're very welcome. Now, do you have any other questions or concerns you'd like to talk about today?
Not today. Thanks.
Okay, well, if you think of any other questions, please feel free to call the office. Now, you take care, and I'll talk to you soon. Now, many clinicians ask, who is a candidate for hormonal therapy? Unless there's contraindications, estrogen therapy is indicated for treatment of bothersome vasomotor symptoms, treatment of genitourinary syndrome of menopause, prevention of bone loss, and women with hypoestrogenism caused by any of these problems in this slide, including hypogonadism, primary ovarian failure, bilateral oophorectomy, or premature surgical menopause. Contraindications include unexplained vaginal bleeding, severe active liver disease, prior estrogen sensitive breast or endometrial cancer, coronary heart disease, stroke, or personal history or inherited high risk of thromboembolic disease and dementia. Bottom line, hormonal therapy is the most effective treatment for both vasomotor symptoms and genitourinary syndrome with menopause. When prescribing hormonal therapy, in the woman who has a uterus, endometrial protection should be addressed, and progestin therapy should be added to systemic estrogen therapy. Progestin therapy is not recommended with low-dose vaginal estrogen, but appropriate evaluation of the endometrium should be performed if vaginal bleeding occurs. It's important to discuss the potential risks of hormonal therapy with all postmenopausal women and try to direct these risks to that individual woman's medical history. It's also important to individualize the risks versus the benefits for each of our patients, taking into account their age, their health history, and other factors that you may want to consider when deciding whether this is an appropriate patient or inappropriate patient for hormonal therapy. When weighing the risks and benefits of hormone therapy, level 1 recommendations note that the benefits are more likely to outweigh the risks for symptomatic women who initiate therapy when aged younger than 60 years or within 10 years of menopause onset. But it's important to also remember that when discussing the risks and the benefits, it truly is shared decision making, which means that you and the patient come to the conclusion as to what is best for the patient and what fits her needs with the symptoms that she's describing. Now let's return to our patient case, Ms. Collins. You recall that her second telehealth visit, she was started on hormonal therapy. Now let's look at her at the next telehealth visit. Hi, Ms. Collins, nice to see you again.
Hi, Dr. Bachman. Nice to see you.
So I'm reviewing your chart, and you've been taking the hormonal therapy for 3 months now, right? How's that been going?
I think it's really helping with my hot flashes and night sweats. I'm sleeping better, which is huge good news for me. I still get up to use the bathroom once or twice every night, but that's better than it used to be.
I'm so glad to hear that. Now, has it helped with the vaginal dryness and pain that you told me about last time?
Maybe a little, but I'm still having that burning pain during sex, even when we use lubricants.
Well, thanks for letting me know. And that's not uncommon, but it does mean we probably want to consider trying a topical treatment. This might help with your bladder symptoms as well.
That certainly sounds worth a try.
Okay, so these treatments are estrogen based, and we have a few options. There's low dose vaginal estrogen therapy in a cream format. So it comes in a cream that you would apply daily for 3 weeks and then off for 1 week. And that would be to start, or a tablet or gel cap that you insert into your vagina twice weekly, or a vaginal ring that you would replace every 90 days. Do you want more information about these options, or do you have a preference right now?
Hmm. After all the time I've spent applying lubricants and moisturizers, I think I'd like an option that doesn't require me to apply a cream every day. The ring sounds easiest.
Okay, so then let's get started on that. And we could have another follow-up visit in 3 months to see how it's working for you.
Sounds good. Thank you.
So the outcome of Ms. Collins' third telehealth visit is that she explained that despite using hormonal therapy systemically, she was having genitourinary syndrome of menopause symptoms, and therefore topical estrogen concerns and dryness were addressed. So here's the crux of telehealth visits. When is an in-person visit necessary for the postmenopausal woman who has symptoms of menopause? And these are really key. The woman with postmenopausal bleeding, the woman with prolapse and needing a pessary fitting, the cervical cytology or mammograms are not up to date, that she needs laboratory testing, or there are specific needs for a physical exam, imaging, or other evaluations. There are many clinician resources that all of us can use for telehealth and also for guidelines on the use of hormonal therapy in postmenopausal women. You can find all these links in the resources section for this activity, and these slides are available for download as well. So what are the key take-home points regarding telehealth visits? Bottom line, it's an excellent way to assist symptomatic postmenopausal women who do not require an office visit. So let's wrap up by reviewing SMART goals that you can carry into your practice. That is, when providing telehealth consultations for your postmenopausal patient, confirm the mammogram and pap testing are up to date, ask patients about the menopausal symptoms they're having, provide education, empathy, and empowerment, counsel patients on the risks and benefits of treatment options, engage in shared decision-making, and have electronic resources ready to provide to all patients. To receive CME CE credit for today's program, click on the Evaluations tab to complete the post-test and print your certificate. Thank you again for participating, and thank you for providing the best care for postmenopausal patients.
I'm really glad my doctor took the time to help me understand the risks and benefits of hormone therapy and the different delivery options available. I felt like we were making a decision together instead of just having a doctor prescribe a medicine for me without my understanding why. I feel comfortable knowing I can call her with any questions I have. I hope this helps my symptoms. I'm optimistic.